All right, we're back here talking to Jenn Fanning with Grand County Rural Health, and you guys have such an incredibly important role in our community here. And just as an example, I was once a ski bum. Come to town, I've got, you're paid, you're working ski bum wage, you're not working a lot. You don't know anything about health care or health insurance, and all of a sudden you get sick or you break your knee, or talk to us about some roles that they can fulfill for some of the people that either don't have the money or don't know about insurance and health
Absolutely. So we have a couple programs called Aches and Pains for adults and kiddos that help people get into a doctor when they're sick. Unfortunately, we don't do injuries just because it opens up a whole variety.
Right.
We don't have the money for that. We have other ways that we can help guide people towards that. But for example, you get sick. You're working 3 jobs like ski bums often do. In the middle of winter, right after Christmas, you get the flu or whatever. You need to go in to see the doctor. We don't want you to go to work sick. We don't want you to get everybody else sick. So we have a program that's Aches and Pains, Aches for kiddos, Pains for adults. It's entirely locally funded. That gets you into the doctor. We pay for the doctor's visits. We pay for pharmaceuticals. And for kiddos, we will do preventative care and dental for the kiddos. And then we also have mental health availability. So anybody who is suffering from any kind of mental health illness, depression, it's huge. Everybody.
Our winters are long, our days are dark, it's cold, you're away from your family. Or, if you've come here like I did, you moved completely far away from everyone you know, and it's wonderful to have that support as well. So.
Absolutely. Well, and something most people don't know, something like 87% of people will have some kind of mental health illness, diagnosable illness in their lifetime. It's not abnormal. We want to make sure people get what they need. So you go in, you get the flu, you go in to see the doctor. Some people have been diagnosed with, for example, cancer through this program, through Pains. So we also have a cancer program, cancer-related services that is entirely locally fundraised from volunteers. Volunteers fundraise for that. And we provide gas vouchers, hotel vouchers, basically any kind of supportive services. We don't actually help with the treatment because there's other ways to do that, but any kind of supportive services to get people to the treatment that they need and any follow-up care. And then we have a patient navigator program who can take that person, especially when you're having a chronic disease, you get diagnosed with a new disease. It's nurse navigators, so we're unique in that we employ nurses.
So you actually have nurses on staff
Correct.
Who can meet with the individual, and they're not treating them in that meeting.
Correct. They're really creating an action plan, really working on educating the individual about their chronic disease, about the healthcare system, trying to remove any barriers to care, transportation.
Some treatments are beyond local here. I mean, are you
most
guys helping to arrange?
Most large treatments,
okay, so you're helping to get an action plan with the city, Denver. I mean, it can be overwhelming to where you need to go, what you need to do, and who you need to see. Okay.
Yeah, absolutely, and really trying to help navigate that, creating an action plan. We were pretty innovative with that program. We were one of the first ones that employed nurses in the state, and then one of the first that were rural generalists, so we'll work on any disease. Some navigator programs work on cancer, for example, or cardiovascular. We'll do anything for anybody on any income level, anybody who's having any kind of issue. We want to help because it's confusing.
This isn't just for the poor or this is for, I just don't know and I need some guidance and help. That's incredible.
Yeah.
Nice. And so you mentioned some fundraising locally. I mean, do you guys have events that you do for fundraising? Is it state funded, or what are some of the channels of revenue that you get?
Sure. We diversify our funding all over. We have federal grants, state grants, foundation grants, and then we do a lot of fundraising. We have our event called Bulls, Boots, and Barbecue. It'll be September 11th of this year.
Boots, and Barbecue. I'm guessing that has to do something about rodeo.
Kind of, yeah. I mean, it's really honoring the past. We have a really unique and historic past of healthcare in our community. Doc Susie, for example. Yeah. There's a whole host of them. And then we're doing a lot of innovative things between like the patient navigator, and we're creating an app for the healthcare system to include early childhood and social emotional development for kiddos. It's called a Ages and Stages questionnaire. It's a standardized developmental screening app that all of our healthcare providers, all of our child care providers are using. So it kind of delves into the systems approach to try to improve the systems of healthcare, not just the individual kind of Band-Aid stuff that the other programs are doing. So yeah, we have, kind of segueing a little bit, but we have all of a whole host of resources and a whole host of fundraising.
donations, you guys can do the website.
Absolutely.
Website and just click donation, call in, stuff like that.
Absolutely. We've got all the information there. We also, like I mentioned, our cancer-related services is 100% volunteer-led fundraising. So they do a race in Grand Lake in September, a golf tournament in Grand Lake. There's a golf tournament at Pole Creek in the summertime, things like that.
Lots of fun events too. So on the other side of that, if they're looking for help with grants and stuff, just call the toll-free and free consultation of some sort, or how does that work as far as if I'm calling in for help with this and to apply for?
Give our office a call, 725-3477, and
kind of the first step, basically.
Absolutely.
Make the call and
absolutely. We have
conversation can go a long ways.
Yep, absolutely. Just call. Worst we can say is no. We're not going to say that. We'll at least send you somewhere else and make it as easy and seamless as possible. That's our role.
Well, great. Well, we're going to take a quick break here, but we'll come back and then we'll talk about a little more into healthcare specifically. But with that, we'll take a great break and see what's going on outside.